26 million Americans are affected by kidney disease. Are you one of them? Chronic kidney disease can silently damage your kidneys over time, but don't worry, there's hope. Today, we'll uncover essential steps to manage CKD and show you how simple changes in your diet can make a massive impact on your health. At the end of this video, we'll reveal the 20 best foods for CKD patients that you can easily add to your daily diet. Hit that like button and let's dive in. But let's shift gears for a moment. What if you already have kidney disease? Does that mean all hope is lost? Absolutely not. Depending on the stage of your kidney disease, which ranges from stage 1 to 5, the foods you should eat become even more important. And today, I'm going to share with you the specific changes you should make if you're between stage 3A and stage 5. Here's where things get really interesting because every food you put in your body can either help or harm your kidneys. Think of your kidneys as a massive filtration system with tiny little filters called nephrons. When these nephrons get damaged, your kidneys lose their ability to filter properly, which means waste starts building up in your blood. And here's the twist: you start seeing nutrient imbalances with things like phosphorus, potassium, and sodium levels getting out of whack. But don't worry, because I'm going to show you exactly what to eat to avoid these pitfalls. And trust me, the right food choices can make a world of difference. Step 1 is all about salt and sodium. Did you know that most people consume way more sodium than they need? And if you're dealing with CKD, the impact is even greater. Sodium controls your blood pressure, and high sodium intake can cause hypertension, which puts even more strain on your already damaged kidney. So, how do you take control? First, focus on buying fresh food as often as you can. Packaged or prepared foods might be convenient, but they often come with a hidden cost: tons of added sodium. That frozen pizza or canned soup? It's packed with sodium, and it's working against your health. A simple swap here is to start cooking from scratch. Sure, it takes more effort, but it's one of the best things you can do. You'll know exactly what's going into your food, and you can control the seasonings. Speaking of seasonings, try replacing salt with spices, herbs, or sodium-free seasonings. You'd be surprised how much flavor you can get from fresh herbs and a bit of creativity in the kitchen. When you're shopping, don't skip the food labels. Look for sodium percentages, and here's a quick tip: anything with 20% or more sodium is considered high. Go for foods that are 5% or less, and you're already winning. Now, imagine rinsing those canned vegetables or beans. Before cooking, they lose a lot of their sodium that way. It's all about the small steps that lead to big results. Now, let's talk protein, because this is where a lot of people get tripped up. When you hear protein, you might think it's always a good thing, but for someone with CKD, too much protein can actually make things worse. Why? Because when your body processes protein, it creates waste that your kidneys then have to filter out. The more protein you consume, the harder your kidneys have to work. So, we'll balance it. Think of protein as something you want in small portions. A piece of chicken or fish about the size of a deck of cards is perfect. You don't need a huge steak to get the nutrients your body needs. Animal proteins like chicken, fish, meat, eggs, and dairy are important. If you're vegetarian or just trying to cut back, plant proteins are great too. Beans, nuts, and grains can give you the protein you need without overloading your kidneys. Just keep those portions in check. About half a cup of cooked beans or a quarter cup of nuts is plenty. It's all about being mindful of what your body can handle. Speaking of balance, your heart health plays a major role in managing CKD. The last thing you want is fat building up in your blood vessels, heart, and kidneys. That's why the third step is about choosing heart-healthy foods. So instead of reaching for that fried chicken, how about grilling or broiling it instead? You can get the same great taste with far less fat. Non-stick cooking spray or a drizzle of olive oil works wonders, and trimming the fat off your meat or removing the skin from poultry helps too. It's these small shifts that make a big difference. Read those food labels carefully, because saturated and trans fats are the sneaky culprits that can damage your heart over time. Lean cuts of meat like loin or round, skinless poultry, fish, beans, and veggies should become your best friends. And let's not forget about dairy. Low-fat or fat-free options can give you the calcium and protein you need without the extra fat. Now, picture yourself making these changes. You're trimming fat using heart-healthy oils and swapping butter for olive oil. Your heart, blood vessels, and kidneys will thank you. Now, as your CKD progresses, there are a couple more steps you'll want to pay close attention to. This is where it gets even more important to manage what you eat, because certain nutrients like phosphorus and potassium can build up in your blood. It's especially dangerous when you consume it in the form of phosphoric acid. If that happens, it can cause serious problems with your bones, blood vessels, and heart. So, let's dive into step 4, phosphorus. Phosphorus might not be something you think about when planning your meals, but it's crucial for someone with CKD. Too much phosphorus can pull calcium from your bones, making them weak and prone to breaking. It can also cause itchy skin, bone pain, and joint problems. So, how do you avoid this? Start by cutting back on processed foods. Deli meats, certain fresh meats, and poultry can have added phosphorus. So always check the labels or ask your butcher for meats without added phosphorus. Fresh fruits and veggies, breads, pasta, and rice are all lower in phosphorus, and they're great options for keeping your phosphorus levels in check. Have you ever looked at the ingredient list of your favorite soda? Sodas are one of the worst things you can drink if you have kidney disease. Not only do they contain sugar, which worsens insulin resistance, but the phosphoric acid directly harms your kidneys. If you've got a soda habit, it's time to kick it. Trust me, your kidneys will thank you. Dark-colored sodas are often high in phosphorus, so you might want to swap them for a lighter option like lemon lime soda, or, better yet, homemade iced tea. Your doctor might also recommend a phosphate binder, a medicine that helps keep phosphorus from getting into your blood. It's like a sponge that soaks up phosphorus before your body can absorb it. This simple step can go a long way in protecting your bones and overall health. Now come to potassium, which plays a big role in making sure your muscles and nerves work properly. But here's the thing, when your kidneys aren't functioning well, potassium can build up in your blood, leading to dangerous heart problems. This is why step 5 is all about keeping your potassium levels in check. So, how do you do that? First, be cautious of salt substitutes. They often contain high amounts of potassium. Always check the ingredient labels, and don't hesitate to ask your healthcare provider if a product is safe for you. Draining canned fruits and vegetables before eating them can also help reduce potassium levels. Let's talk food choices. Apples, peaches, carrots, cabbage, cauliflower, radishes, cucumbers, onions, and green beans are all lower in potassium, and they're delicious additions to your diet. On the flip side, foods like oranges, bananas, potatoes, avocados, spinach, kale, and tomatoes are high in potassium, so you'll want to limit them. Instead, go for white bread, pasta, or rice, which are lower in potassium than their whole grain counterpart. And don't forget to watch what you drink. Apple, grape, and cranberry juices are better options for keeping potassium levels in check, whereas orange juice or tomato juice can be too high. Some medications can also raise potassium levels, so always check in with your healthcare provider to ensure you're on the right track. So, are you ready to discover the 20 best foods that can do wonders for your kidneys? Food number 18 and 20 will shock you. Let's dive in. 1. Cabbage. Let's start with cabbage, a true powerhouse for your kidneys. This leafy green is packed with vitamins K, C, and B, plus it's low in sodium, potassium, and phosphorus. It's also fantastic for digestion, thanks to its high fiber content. Enjoy cabbage in soups, salads, or stir-fries. How do you like to eat your cabbage? Share your recipes with us in the comments. 2. Bell peppers. Brighten up your plate with bell peppers. These vibrant vegetables are low in potassium and rich in vitamin C and vitamin AA, which support immune function. Whether roasted, stuffed, or sauteed, bell peppers are a delicious and versatile addition to any kidney-friendly diet. Blueberries. Blueberries are more than just a tasty treat. They're loaded with antioxidants called anthocyanins, which help detoxify your kidneys. They're also low in sodium, potassium, and phosphorus. Add them to smoothies, cereals, or eat them fresh for a healthy snack. 4. Cauliflower. Cauliflower is a fantastic, kidney-friendly option. It's packed with vitamins K, C, and B, and is high in fiber with anti-inflammatory properties. Use it as a substitute for mashed potatoes or add it to your stir-fries. It's a great way to enjoy a low-potassium alternative. 5. Egg whites. Egg whites are a top choice for kidney health. They provide high-quality protein without the phosphorus found in egg yolks. Perfect for omelets, salads, or as a protein boost in various dishes. If you're curious about the egg diet, check out our video on what happens when you eat eggs. 6. Onion. Onions might leave you with a bit of bad breath, but they're great for adding flavor without extra sodium. They're rich in vitamin C and B, and their prebiotic fibers support healthy digestion. Cook them up with other vegetables or use them raw in salads. 7. Olive oil. Olive oil is a staple in many kitchens, and for good reason. It's a source of healthy fats and is free of phosphorus. Its anti-inflammatory properties make it a great choice for those with kidney disease. Use it in cooking, as a salad dressing, or for marinating vegetables. 8. Garlic. Garlic not only adds amazing flavor to your dishes, but is also a great low-sodium alternative to salt. It's packed with vitamin C, B, and sulfur compounds that have anti-inflammatory benefits. Add garlic to your recipes to enhance both taste and health. 9. Red grapes. Red grapes are packed with flavonoids and vitamin C, making them excellent for reducing inflammation and supporting heart health. They're low in potassium, so they're a great snack option for those managing kidney disease. 10. Sea bass. Sea bass is low in phosphorus and high in protein and omega-3 fatty acids. These healthy fats help reduce inflammation and can boost your mood. Try pan-frying sea bass with a lemon garlic herb sauce or baking it for a delicious and nutritious meal. 11. Kale. Kale is known for its powerful medicinal properties. It's loaded with antioxidants and vitamins that help regulate blood sugar, making it beneficial for those with diabetic nephropathy. Just remember to enjoy it in moderation due to its medium potassium levels. From salads to smoothies, kale is a versatile green. 12. Macadamia nuts. Unlike many nuts, macadamia nuts are low in phosphorus. They're also rich in healthy fats, B vitamins, and essential minerals like magnesium and iron. They make a great snack for people with kidney disease. 13. Buckwheat. Buckwheat is a gluten-free grain that's low in phosphorus and packed with B vitamins, magnesium, and fiber. It's an excellent option for those with kidney disease and gluten intolerance. Look for buckwheat noodles, bread, or pancake flour next time you shop. 14. Bulgur. Bulgur is a whole grain that's low in potassium and phosphorus, making it perfect for kidney-friendly diet. It's rich in plant-based protein and dietary fiber, and it provides essential nutrients like magnesium, iron, and B vitamins. 15. Skinless chicken. Skinless chicken breasts are a great source of high-quality protein without the added sodium, potassium, and phosphorus of skin-on chicken. Use moderate spices to keep it flavorful and kidney-friendly. Baked or grilled, skinless chicken is a tasty and nutritious option. 16. Radish. Radishes are low in potassium and phosphorus and high in vitamin C, which supports heart health. Their crisp, peppery flavor makes them a great addition to salads or sauteed veggies. Add radishes to your diet for a refreshing and kidney-friendly boost. 17. Pineapple is a sweet, low-potassium fruit that's rich in fiber, vitamin C, and bromelain. It's a great alternative to high-potassium fruits and can help reduce inflammation. Enjoy pineapple fresh, in smoothies, or as a tropical treat. 18. Arugula. Arugula is a leafy green that's low in potassium and high in vitamins K, calcium, and magnesium. It also contains nitrates that can help lower blood pressure, which is important for kidney health. Add arugula to your salads for a spicy, nutritious twist. 19. Cranberries. Cranberries are fantastic for both urinary and kidney health. They contain compounds that prevent bacteria from sticking to the urinary tract, reducing the risk of infections. They're also low in potassium, phosphorus, and sodium. Enjoy them fresh, dried, or as juice, without added sugar. 20. Shiitake mushrooms. Shiitake mushrooms are a great meat alternative for those with kidney disease. They're lower in potassium than white mushrooms and packed with plant-based proteins, B vitamins, copper, and selenium. Toss them in stir-fries, pasta, or use them as a pizza topping. Share your experiences, tips, or favorite kidney-friendly recipes in the comments below.